Carrying high means it's a girl. The claim is simple and confident. If the bump sits high, it's a girl. If it hangs low, it's a boy. Generations of relatives have declared this at family gatherings with absolute certainty. The origin predates ultrasound technology entirely. When there was no way to determine fetal sex before delivery, visual assessment of the mother's abdomen became the dominant guessing method. Entire communities built prediction traditions around bump shape. The biology tells a different story. Bump position is determined by the tone of the abdominal wall, the position of the uterus, the number of previous pregnancies, and how the fetus happens to be lying at any given moment. A first-time mother tends to carry higher because her abdominal muscles have never stretched to accommodate a pregnancy before. That tighter wall holds everything closer and higher, regardless of whether the fetus carries XX or XY chromosomes. The pattern feels real because people remember the correct guesses and forget the misses. Your bump is a portrait of your own body. It has never been a portrait of your baby's sex. Heartbeat over 140 means it's a girl. Another gender prediction myth, this one dressed in clinical clothing. The belief holds that a fetal heart rate above 140 beats per minute indicates a girl, while anything below signals a boy. It gained traction after a single study published in 1993 suggested a correlation. That study was small. Subsequent research dismantled it thoroughly. The normal fetal heart rate ranges between 120 and 160 beats per minute and fluctuates constantly. Gestational age, fetal movement, and whether the baby is awake or asleep all influence the number on the monitor at any given moment. A 2018 meta-analysis examining over 10,000 pregnancies found no statistically significant difference in heart rate between male and female fetuses before labor. During active labor, slight variations have been observed, but by that point, the baby is typically minutes from arrival. A number on a screen during a routine scan is measuring cardiac function. It is not revealing a nursery color. Morning sickness only happens in the morning. The name itself is the myth. The phrase morning sickness has convinced generations of people that pregnancy nausea confines itself to the early hours and politely disappears by lunch. The biology has no interest in the clock. Nausea and vomiting in pregnancy are driven by rapidly rising levels of human chorionic gonadotropin and fluctuating estrogen, hormones that circulate continuously. Research in obstetric journals shows that fewer than 2% of affected women experience nausea exclusively before midday. The morning association likely stuck because an empty stomach after overnight fasting intensifies nausea, making the first waking hours particularly brutal. You know the feeling. The wave hits before your feet reach the floor, but for most women, it returns at noon, at 3, at dinner, at midnight. The term morning sickness is a misnomer that quietly teaches women their all-day suffering is somehow unusual when it is, in fact, the norm. Spicy food induces labor. The advice arrives like clockwork in the final weeks. Eat a hot curry. Order the spiciest thing on the menu. It will get things moving. This belief spans cultures and centuries, rooted in folk medicine traditions that associate strong digestive stimulation with uterine activity. There is a superficial logic to it. Capsaicin does stimulate the gastrointestinal tract. It can trigger gut contractions and the release of prostaglandin, like compounds in the digestive system. But the prostaglandins responsible for cervical ripening and uterine contractions are produced locally within the uterus through entirely separate biochemical pathways. Your gut and your uterus are not sharing a triggering mechanism. No randomized controlled trial has demonstrated that capsaicin consumption initiates labor. The confirmation bias is powerful here. Women near their due date eat spicy food and then go into labor hours later, but they were almost certainly going into labor anyway. The curry is comfort food at the end of a long 9 months. It has never been an obstetric intervention. You must eat for 2. The instruction sounds generous and caring. You're pregnant, so eat twice as much. It likely emerged in eras when caloric scarcity was genuine, and an extra plate of food could mean the difference between a viable pregnancy and a dangerous one. In context of abundance, the advice becomes harmful. Current guidelines from major obstetric bodies recommend approximately 340 additional calories per day during the second trimester and 450 during the third. That is roughly one extra balanced snack. A banana with peanut butter, a small bowl of yogurt and granola, not an entire second dinner. Excessive gestational weight gain is associated with increased risk of gestational diabetes, preeclampsia, and macrosomia, a condition where the baby grows significantly larger than average, complicating delivery. Eating for two has never meant doubling your plate. It means eating thoughtfully for two distinct sets of nutritional needs, one of which is remarkably small. Cocoa butter prevents stretch marks. The beauty industry has built a considerable market on this promise. Apply cocoa butter daily, and you will emerge from pregnancy without a single stretch mark. The packaging features smooth, unmarked skin. The implication is clear. Stretch marks, clinically termed striae gravidarum, are caused by rapid stretching of the dermis combined with hormonal changes that weaken collagen and elastin fibers beneath the surface of the skin. The damage is structural and subcutaneous. A Cochrane review examining multiple randomized trials found no statistically significant difference in stretch mark occurrence between women who used cocoa butter and those who used a placebo or nothing at all. Genetics, skin type, and the speed and extent of growth are the dominant factors. What cocoa butter does accomplish is moisturizing the skin's surface. Moisturized skin feels more supple and itches less, which is genuinely comfortable when your abdomen is expanding rapidly. Skin comfort and scar prevention are two completely different things, and one has never guaranteed the other. The shape of your face reveals the sex. If your face gets rounder and fuller during pregnancy, the old belief says you're carrying a girl. The explanation offered is that a female fetus steals the mother's beauty. Facial puffiness in pregnancy results from a roughly 50% increase in blood volume, widespread fluid retention, and hormonal shifts that affect all soft tissue. These changes occur identically regardless of fetal sex. Every pregnant body processes more fluid than it did before conception. The stealing beauty narrative carries an additional weight worth noting. It frames female fetuses as inherently draining, something that takes from the mother rather than simply growing alongside her. A rounder face during pregnancy is evidence of your cardiovascular system working harder than it has ever worked. It is a sign of physiological effort, not a gendered judgment. Flying is dangerous throughout pregnancy. The blanket warning suggests that pregnant women should avoid aircraft entirely. No flying, not at any stage. The reality is considerably more specific. Most major airlines and obstetric guidelines consider air travel safe for uncomplicated pregnancies up to 36 weeks. Cabin pressure in commercial aircraft is maintained at levels equivalent to an altitude of roughly 1,500 to 2,400 meters, well within a tolerable physiological range. The genuine concern is deep vein thrombosis. Prolonged immobility in a cramped seat increases clot risk for all passengers, and pregnancy elevates that baseline risk slightly due to changes in blood coagulation factors. The management is straightforward. Compression stockings, regular movement, aisle seats, hydration. These are specific, addressable precautions. The difference between a blanket ban and a specific manageable risk is the difference between fear and informed decision-making. Raising your arms above your head causes cord entanglement. The warning is vivid. Don't reach overhead. Don't hang washing on a high line. Don't stretch upward. If you do, the umbilical cord will wrap around the baby's neck. Nuchal cord, the clinical term for this occurrence, happens in roughly 20 to 30% of all deliveries. It is caused by fetal movement within the amniotic space. When the baby turns, rolls, and somersaults through the fluid, and sometimes the cord loops around the neck in the process. Maternal arm position has no anatomical connection to this event whatsoever. The origin likely traces to a pre-scientific need to explain a frightening complication. If the cord was tangled, something the mother did must have caused it. Assigning controllable behavior to an uncontrollable outcome offered the illusion of prevention. This myth survives by manufacturing fear from a normal movement and guilt from a common, usually harmless occurrence. Pregnancy brain means you're losing intelligence. The jokes write themselves. Can't find your keys. Forgot the word you wanted mid-sentence. Walked into a room and stood there blankly. Pregnancy brain, people say, smiling. As though carrying a child quietly dissolves your competence. Some studies do indicate minor changes in memory consolidation during the third trimester, likely related to significant sleep disruption and substantial hormonal shifts. The forgetfulness is real for many women, but the interpretation is wrong. Neuroimaging research has revealed that pregnancy triggers extensive gray matter remodeling in brain regions associated with social cognition, threat detection, and emotional attunement. These changes are not deterioration, they are specialization. The brain is reorganizing itself to prepare for the demands of interpreting a nonverbal infant's needs, and these structural adaptations persist for years after delivery. The occasional misplaced word is not evidence of a mind declining. It is a side effect of a brain quietly rebuilding itself for the most complex relationship a human body can prepare for.